So now let's talk about your experiences during your St. Joseph's rotations. So Sharjeel, describe your work and your rotation at the campus.
Yeah, sure. Depending on what rotation that you're specifically on, your day will go differently based on what you're on. Just talking about general internal medicine wards, you'll typically get to the hospital around 6 o'clock or 7. You'll pre-round on your patients, and depending on the type of attending you'll be working with, you'll do both table and bedside rounds, followed by taking care of all of the orders and following up on the things that you guys discuss on rounds. And once your patients are all taken care of, all your notes are done, you can pretty much get out of the hospital whenever you're done with your work, unless you're on call, which you'll be sticking around until about 8 p.m.
Now, you were saying it depends on your rotation. What do you mean by that? Are there different rotations for different time periods throughout your year?
Yes. So we do about 5 or 6 months of general internal medicine wards. That's like the bread and butter of internal medicine residency. And then we spend typically another 6 months or so on electives, such as doing things like cardiology, gastroenterology, nephrology, and doing ER rotation and ICU. So, and based on what rotation you're in, your day will go a little bit differently each month.
Okay, good to know. Thank you. Tess, did you have anything to add to that?
Kind of the fun thing about OBGYN in general is you kind of start your day not really knowing what's going to come in. Sometimes you might have a scheduled C-section, or you might be delivering babies, or you might be, in OB triage, kind of interacting with women with obstetric complaints. And then if I was on like a gynecology rotation, I could be operating more and doing I could be in the clinic. I could be doing more operations like hysterectomies. And so it kind of depends on what rotation I'm on and what my, what year I am. But kind of like how all residency programs work is we typically rotate through different, each month we rotate through a different rotation.
Okay, thank you. So Marco, what is your rotation like?
Yeah, as Sharjeel say, we are in internal medicine. We go for different rotation, but actually the core of our year is during wards. We start our day at almost 5 to 6 a.m., checking our patient that they remain stable. We go examine them, try to help them, then go to get the input from the night shift to give us updating our patient, talk with our nurses about the input from the patient, and then we round with the medical team to challenge us to make our decision about the diagnosis for our plan. Then around 5 to 6 p.m. probably we go to the night shifts to actually sign out our patient so they can take care of them, and then we can go home.
Okay, thank you. So Stephanie, what are your rotations like?
So in radiology, quite a bit different than the other three have described. So we have 4-week block rotations, and they're all separated kind of by body part. So they have a chest service, you have an abdomen service, you have a pediatrics service, you have neurology service, and beyond. I mean, the list is quite long. So we are more like shift workers. So we come in the morning and we have an AM teaching conference just about every day, as well as at noon. And in between those times, we sit down on whichever service that we are assigned to that month and look at those studies. There usually is a first year or a brand new resident as well as a senior resident, and you just start reading studies because you could be very busy during the day or it could be slower. You really never know what's going to come in. So that's more of the day schedule. And then you leave once our, kind of almost like you clock out, like once the last study is done for the day, you read that and then you leave. There's a lot less sign out. We still have, some things that trickle over for the evening person. We don't have quite the same protocol, but we still have some sign out. And then the evenings and nights and weekends are done by an on-call resident who reads everything that comes in through the ER, through inpatient, and they're helping with protocoling studies for the next day. So there's a lot going on all at once, and it kind of never stops. But it's very interesting.
Okay, well, thank you, Stephanie. It was, and all of you actually, that was very insightful learning about how each of you go along through your rotations and your days.